Home health care is a rapidly expanding industry. As healthcare providers strive to reduce healthcare costs by decreasing hospital length of stay, patients are being discharged sooner, or they're receiving services and surgery on an outpatient basis. Hi, I'm Kathy Getrust. I'm an instructor in community health, and today we're going to be talking about caring for patients in their home. Most people are happier and more secure if care can be provided within their own home. The definition of home care is care that is provided in a person's place of residence. This might be short-term, intermittent, skilled care. It might be rehabilitative care where someone needs to come into the home, such as a physical therapist, and do some muscle strengthening exercises after a fall. It might be long-term supportive care where a home health aide would be coming in to assist with activities of daily living, such as assisting with feeding, toileting, grooming, dressing, those kinds of things. Or it might be end-of-life hospice care that would be provided in the home. The trend, however, is for home care. It's growing not only because hospital patients are being discharged sooner, but also because people are living longer, and technology is allowing patients to be living much longer than ever before, as well as the population is growing. Home health care is really a unique field. Care is provided in the patient's home. Now, we think of a patient's home as being a freestanding residence, but it can be a senior apartment complex that you might be giving care. It could be a group home. It might be an assisted living facility where the individual is. So the patient's residence really varies greatly. Care in the home is also done, but with the family, and friends sometimes are there along with the patient, and pets. So it's very different from long-term care or hospital care in that regard. Patients and families in the home make the rules and set the standards. That's really an important thing to remember in home health care, that we as caregivers are their invited guests and need to respect them and their place. There are a variety of types of home health agencies. Some are privately owned, for-profit or non-for-profit. Some are publicly operated health departments. Probably the ones that you're most familiar with are hospital-based home health agencies. Most large hospital systems nowadays have an arm of their organization which is a home health agency. There's a variety of services that can be provided in home health. Might be private duty care. Private duty care could be housekeeping responsibilities, might be personal care, might be a companion that's required. Sometimes a family is caring for a patient and they want on a weekly basis for a companion or a homemaker to come in and do some light housekeeping and read to the patient so they can get a break from their caregiving responsibilities as the family member. Another type of service that's provided in the home is what's called skilled care. Skilled care means that the care is provided by professionals in health care. It might be a registered nurse, or it could be any variety of therapists, such as physical therapists, occupational therapists, and the like. Skilled care would be things such as a patient who was newly diagnosed as a diabetic and might need some instruction on how to manage that diabetes, as well as sometimes the family needs to be made aware. They might also be needing instruction on how to administer insulin. This would be professional services that the nurse would provide. Another type of skilled service might be wound care. The nurse would be coming in and assisting with wound care management for an individual. Another kind of service that can be provided is hospice service, and that again is an end-of-life service when a person is nearing death and they have chosen to remain at home to be able to die in their own environment. Sometimes it'll be the nurse that comes in, could be you as a home health aide, might be a chaplain or social worker as well. There's a variety of reimbursements for home health services. Medicare and Medicaid typically will pay for skilled services. Those are the services I previously mentioned where there is a professional nurse or a therapist that's coming in to do some skilled care. There might also be some private insurances that will pay for home health services. For some services, particularly the private duty companion type of services, would be taken care of by the client's own personal funds. Typically, insurances and Medicare, Medicaid do not cover that particular companion service. There are a wide variety of people involved in the home health care team. Besides the patient and family, you have professional nurses, nursing assistants, therapists, sometimes occupational or physical therapists, physicians, social workers, homemakers, and others. There are some real advantages and disadvantages to working in the home health field. Some of the prime advantages are that you have the satisfaction of being able to provide complete patient care. In the hospital or sometimes in the long-term care facility, you may be doing a portion of the patient's care, but you are able in the home setting to do much more complete care to them, from assisting with meal planning and preparation, to shopping, to light housekeeping, to activities of daily living. Another advantage is you have the opportunity to build up a really close relationship or a strong rapport because you are providing for patients in the home over time. Even though in a hospital and long-term care facility, great effort is made to have consistency in caregivers from day to day, that is not always possible. In the home, you will be seeing the same patients typically for an extended period of time, and it allows you an opportunity to get to know them well. Another advantage is that you have the opportunity to work with greater independence. Of course, in the hospital or long-term care facility, you as a nursing assistant would have much more oversight by a professional nurse and others that might be in the unit where you are working. Another advantage is that you can work in a patient's natural setting. It's really nice to be able to get to know the patient's family, get to know their likes and dislikes, hobbies that they might have, ways that they like things done, what's important to them. In their natural setting, you can achieve this in a very, very good way. Some of the disadvantages to working in the home health field is that there is quite a lot of travel involved. You will be seeing several patients in the course of a day. That means that you will be needing to drive from one place to another, and depending on where the home health agency is and the distance from the different patients that you will see, it can be quite extensive. Another disadvantage is the amount of paperwork. This is true for professional staff, particularly in home health, but is also true for a home health aide. One thing that can be a disadvantage is the lack of connection with other employees. Some of us are much more outgoing than others and rely heavily on the social connections that we make with fellow workers. If you are working in the home, you are working quite independent of other folks, and it is more difficult to get to know your coworkers. Another disadvantage is that there is lack of immediate professional assistance in the home. If you are working in a hospital or nursing home and there happens to be an emergency, someone falls or somebody is starting to choke on a piece of food, you can just step out the door or you can put on a call light and someone would be there immediately. Obviously in the home that is not the case. Even though you would have a cell phone available to you, it is not as immediate as it is in these other facilities. Home health aides have lots of responsibilities. Some of those responsibilities are to assist with personal cares. Could be bathing, dressing, and grooming a patient. Might be involved in activities of daily living, such as ambulation, toileting, or feeding residents. You might be assisting with mobility devices, helping people use canes, or assisting them with a walker. You might be using a mechanical lift. A lot of the folks that you care for in the home have some type of paralysis. They may be paralyzed from their waist down or sometimes from their neck down, and they will have mechanical lifts in the home that you will use to get them up in the morning, transferring them onto the toilet, into their wheelchairs, and then back into bed at the end of the day. Another responsibility of a home health aide is to assist with some household management responsibilities as well as light housekeeping. This could include washing clothes for the patient, not for their entire family, but you may be asked to do some washing of the patient's clothing. You might do some vacuuming. There are some things that are not included and are not considered light housekeeping, and it would not be your responsibility to shampoo carpets, to clean closets, or to wash windows or floors. Those are things that would be not the responsibility of a home health aide. You would also be involved in planning, preparing, and assisting with the serving of nutritious meals, and helping maintain a safe environment. Ways that you might do that is to make sure medication is stored in a place where other family members cannot get at it. You would want to make sure there were not frayed cords or any kind of electrical wiring problems that you might find in the home. Another way that you would be maintaining a safe environment would be always using a gate belt with your residents. Medication administration would be another responsibility, assisting with the medication that they are to be taking. Grocery shopping might be another. Record keeping, making sure that accurate records are kept of the care that's provided is something that's very important. And also keeping your nurse supervisor informed of any observations that you make in the home or any changes in condition of the patients. Those reports to your nursing supervisor should be done right at the time that you are in the home or shortly after you leave the home. Don't wait until the end of the day. The nurse needs to know this information in a timely fashion, and also it's very easy to forget after you have seen several patients in the course of the day. There are particular qualities and characteristics that make for a competent home health aide. Some of these might include time management. As I mentioned earlier, you will be seeing a variety of patients in one given day. They are all expecting you at a predetermined time, so it's important to be organized and gauge your time and be efficient in the care that you're giving so that you can keep your time schedule accurate. You must also be able to be flexible. Sometimes you may receive a call from the home health agency adjusting your daily schedule. Instead of going to see a patient with who's had a stroke, you might be asked to go and see some other individual. So being flexible is an important feature of being a home health aide. Being dependable and punctual is very important, and it shows respect for the individual. Arriving late on consistently or not showing up for work and having to have a substitute rather frequently certainly does not show respect for an individual. Honesty is also an important thing. Honesty in your record keeping. You will be expected to have a time and travel record where you note the exact miles on your odometer that you have gone with your car so that that can be reimbursed. It's important to be honest about it. I've been aware of some occasions where documentation about actual patient visits were done when in fact the patient visit was never made. So honesty is extremely important. You will also be privy to information in the home discussions that happen within family members. There might be money, jewelry, and so forth laying around, so honesty and integrity is an important piece when you are working so autonomously and independently. Know the limits of your care is another important quality and characteristic of being a home health aide. You want to avoid any possible liability. Sometimes you are asked by patients and families to do things that are not within your role as a home health aide. For example, you might be asked to take the patient to the store or take them to pick up some medication. That's not acceptable for you to drive their car or to take them in your car. If you had an accident, they were injured, there might be some liability issues. They might also ask you to sign some checks for them or make out bills. Those are responsibilities that should be reported to the nursing supervisor and arrangements made for other assistance for the patient to be given. Another is to set realistic boundaries. You have a limited amount of time for each visit, so you have to be able to work efficiently but be realistic. Sometimes patients and families want you to do additional things that were not necessarily on your assignment sheet, and you will have to determine, first of all, if it's within your role as a home health aide and whether or not you have the time to do that. The home environment varies greatly. You will go into some homes that are very small and some that are literally mansions. Some are very clean and some have very offensive odors and are very, very dirty. Each person and family, regardless of the size of their home or the conditions of their home, need to be treated with respect, kindness, and dignity. One of the ways I, in a home health agency, as a home health nurse, has shown respect is in the winter months when snow and ice or mud could be brought in on shoes, is to bring an extra pair of slippers along or little footies and putting those on and leaving soiled boots or shoes at the entrance to the home. This is a way that we can show respect. Another way to show respect is to ask permission before you assume that you could put your coat down on their table or hang it up. Ask them where they would like you to put those things. Don't make judgments about an individual's lifestyle, their habits, religion, or culture. It may be different from your own, but respect that that works for that family. And always protect the family property. Be careful when you're doing light housekeeping not to break precious valuables. And if you have to move things for one reason or another to provide the care, be certain that you put them back exactly where you found them. Be aware and sensitive to the function of the family. They may have values and behaviors that are different from your own. And learn to accept the family's response to illness. Sometimes family members are providing much of the care to the patient and they are totally exhausted much of the time. They're under a great deal of stress because of the illness that the individual is having. They might strike out at you verbally, and recognize that sometimes people respond that way when they're under a great deal of pressure. Develop a good working relationship with the patients and families. Become a really good listener and ask questions and seek to understand what they are trying to convey. Don't get involved in any family conflicts that you may become privy to. The exception, however, might be if you become aware of any verbal, physical, or emotional abuse that may be occurring or that you suspect may be occurring. You have a responsibility to immediately report that to your nursing supervisor so that that can be addressed immediately. Careful written records of the activities that you are doing must be kept. The format for record keeping really varies a great deal from agency to agency. Some of the common forms, however, that you would be utilizing would be a time and travel record. I mentioned that earlier. That would be the amount of time that you spend in the patient's home, as well as the distance that you drove from that residence to the next one that you're going to. And also patient care records. These patient care records would be your home health aide assignment sheet. It could be the care plan and other important documents that are all kept within a folder. This folder is placed in a convenient spot and is developed by the professional nurse for your use when you are in the home. It's important with all of these records to be accurate and to keep your handwriting neat and legible. It also must be complete and always up to date. That means as soon as you leave the residence, do your documentation on that particular individual. Don't trust your memory to complete it at the end of the day. Working with patients and families in their natural home environment presents a different set of challenges than it does if you're working with patients in the hospital or nursing home. Home health aides, through the type of personal care they provide, have an opportunity to significantly influence the quality of care that patients receive.